Yes, sir.
So, did you consider, when you were going through your studies, looking at the difference between those who had lung cancer that was detected early? And I would think that the treatment would be less significant or invasive for that, versus those who were kind of later stage, more involved in it. They may need an entire lung removed or something like that.
Yes.
And if you didn't, just from what you read, do you think that would have an impact on these measures that you...
Great question, and yes, we did look at it. We did not look at it from the standpoint, let's separate out what works for those that have stage 1 cancer versus those with stage 4. What we looked at is, it didn't matter if they were stage 1 or stage 4. If they lived past 2 years, we were still looking at them. But what I will tell you is this, and this is just to give you an idea of what we were up against, is that in one of the studies, 7 to 8 years post-diagnosis, the initial group started with 103 people at year 1. At year 8, of 103 patients, there were 11 still surviving. Stage was not as much of a factor, and it did talk about that in those studies, as the psychological side. That was key. And to me, it's huge for how do we survive these types of cancers, and especially when a doctor may come in and say, and this is what we don't know, but I would venture to say, a doctor comes in and says, you have stage 4 cancer. The probability of you surviving this is 25%. What does that do to a patient that hears those kind of results? Well, to Lance Armstrong, he says, I'll be dadgum if you're going to tell me that I have stage 4 prostate cancer and I'm going to die. But to someone else who has a negative attitude about life in the first place, very different result. What if they say to them, you have lung cancer, the chances of lung cancer survival is about 15%. Then go into stage 1. Stage 1 lung cancer can survive maybe 80%. Don't tell them that, just tell them stage 1, you have cancer, 15% success rate. Well, that doesn't help either with the mindset. So to go back to your question, we did consider that. There were studies that had stage 1 cancers versus stage 1 and 2 versus 3 and 4. The results, though, were still the same on survival. The optimistic.
So that you had a 5-year survival figure up there for like men, which didn't look too good for guys. So that's regardless of stage.
Regardless.
If you are diagnosed with lung cancer, your 5-year expectancy is...
That's right.
Would stage affect that?
Stage could affect that.
Does it say that in stage 1 is your 5-year rate a little bit longer?
It could. Stage 1 typically will live. If they catch it that early, they have a great chance of survival. The problem is we don't catch it usually that early. Somebody has a cough and it just stays a cough, and then all of a sudden it's already attached somewhere else. But along the same lines, most of these studies were stage 3 and 4 that had been taken into training and see what's going on as a result. Some of them were mail-out studies as a result of they've already gone through treatment. They did a collection of information when they were first there, and then they sent it out 5, 6, 7 years later, depending on which study it was. And one study actually went out 10 years, and there were only 5 people left.
I know I'm talking all the time. One more. Are most lung cancers detected earlier, like 1 and 2, or after 1 and 2?
Usually after 1 and 2. In these studies, now...
Is that because they're not symptomatic until...
Well, or people ignore symptoms. Coughs, somebody says, well, I have an allergy, or I have this or I have that, and don't go to the doctor. We don't go to doctors for a lot of things. And this is just another sign of that. But for people that do, you can catch it early, catch the symptoms early and be on your way. Yeah.
But part of it is in the United States or anywhere. We don't really have to go for lungs.
Your X-ray.
MRI typically.
All of that. If you went for a physical,
They will if you're already having lung
If
issues.
you're having like issues, you might.
And-
Lung cancer, the number one.
Yeah, and they're saying, yeah, number one in the
We don't
world.
have a good swing.
Yeah. They are saying that MRIs, but see, you'll order a chest x-ray first, and you have to be able to see the little arms or legs or whatever is on it, whatever y'all call them. Anyway, those little appendages that come off of it, and if they don't see those, then they just assume that, okay, well, maybe it's just scar tissue, and if they don't do an MRI, it's very difficult for them to detect that it's lung cancer. And I may be speaking out of turn. That's just what I read from the stuff that was out there. So nurses, y'all speak up.
Don't start now.
But I tell you what, I really enjoyed doing this because it showed me that physical activity is a really good part. And just to let y'all know, there's a group that's going to be coming to town that it's a doctor who's retired who has taken it upon his life mission to work with cancer survivors and individuals that are going through cancer to provide a free placement for activity for them and actually put them through good programs so that they can get through the treatment healthy, like we were talking about, and post-treatment prolong that life with physical activity. And that's coming to town. We thought we were going to be able to bring it to TCU over in Canese, but it looks like now it's going to be at a site over in a building, in one of the oncology buildings over off of 8th Street. And then at this point, kinesiology students are going to go over and work with them on activity patterns right now. But eventually we see the nursing group, COSD, social work, all being able to interact with these particular people as they come in. So I just want y'all to know that that's up and coming. So this was a great thing to have happen.
Did the different types of treatments have any effect on any of this?
Like the chemo, radiation, and so forth. They were all very similar treatments from what the reports were, but we didn't look at that to see if treatments were different. What was really coming out significant was the stuff that we talked about, that it was the coping strategies, the distress strategies, and the depression.
Were any clinical trial brought in?
No, and that's why it was strictly a systematic review, because we just didn't, what we wanted to know, our question didn't go into what happened with the physiological. We just wanted to see, were there differences in people related to their psychology with moving forward? Now pain, as I told you up here, from a physiological perspective, pain was ranked lower, even though they said they had pain. It didn't feel as painful as for the people that said they had pain, that they really felt pain. And that was the distress group versus the not distress group. Those not distressed lowered their pain levels down. They just said they didn't experience as much pain, that they felt happy to just be alive. And the other group was, I feel lots of pain, I don't feel like I can do activity, I don't want to do activity. And the other group would do activity.
One more question. Did any of the groups use medicine to get that happy feeling, psychological?
You mean like depression and stuff?
Yeah.
No. These were not medications that were given. These were strictly just, they were both coping in their ways without psychological treatment, without medication.
But do you know that? Do you know?
Yeah, that's what they would report in there. They had to report on whether they were on other meds. Pretty interesting. It proved what I thought all along, but that, so far anyway. I think a lot more research is needed. I'm going to bring Susan back up. Thank y'all for your attention.